Hi, everyone. This is Dr. Gayle Carson. Welcome to Living Regret Free, a program that shows you how to live a better and more joyful life. As an added bonus, I invite you to listen to an introduction to my Mindset Matters program, which ties into this so well. Go to www.sobmindset.com. It's free, and I know you will enjoy it. If you'd like to contact me personally, drop me a line at gaylecarson13@gmail.com or go to my website, www.spunkyoldbroad.com, and sign up for my weekly newsletter. My guest today is Dr. Elizabeth Hughes. She's a Stanford trained physician with more than 25 years of clinical experience. And after treating thousands of patients with stress-related illness and having her own life nearly ruined by stress and chronic anxiety, she realized that the conventional medical approach is completely inadequate to treat stress-related conditions, and so she vowed to find a better solution. Her quest led her to non-Western symptoms of health and healing, placebo research, and emerging sciences of epigenetics and psychoneuroimmunology, psychoneuroimmunology. There we go. In the process, she became a registered yoga teacher, a health coach, and a practitioner of several energy medicine modalities. She's developed the stress antidote system, a unique process to turn off the body's harmful stress response, and has helped clients all over the world overcome the root cause of their stress and reverse symptoms of stress-related illness. Welcome, Dr. Hughes.
Thank you so much. And please call me Elizabeth.
Oh, fantastic. I will do that, Elizabeth.
Okay.
Well, there's so much talk about stress, and everybody knows that it's not good for you, and everybody talks about how to deal with it. So you tell us from a biological perspective what stress does to the body.
Well, when you're stressed, your body is actually releasing chemicals, hormones, and neurotransmitters that affect quite literally how every part of the body, every cell, every organ has receptors for these stress hormones. And our bodies kind of have our normal functioning, but then it's some of that normal functioning, the normal way that it uses oxygen or repairs itself, that all gets shut off when you're exposed to the stress hormones. And so there's really no part of you that is untouched by stress. And the big thing is that our bodies need to have times when we're not feeling stress in order to repair themselves. And it actually needs quite a bit of time. Because when you're in stress, of course, you're not doing things, you're not repairing your cells, you're not replacing your blood cells, you're not making new antibodies, you're doing everything sort of not very well from a biological standpoint.
Well, so it affects your health, I would assume, in a lot of different ways. I mean, right. I would think that many illnesses come from this. So what are some of the illnesses that are stress-related?
Oh, yeah. So if you look at the top 10 killers of people, which includes heart disease and cancer and pneumonia and all of those things, they're all related to stress. They all, at some level, the stress hormones and being in a stress, in the state of feeling stressed out, affects all of them. It puts strain on the heart. It can cause changes to blood flow into the brain. So you know that's why people get brain fog, but it can get so far that you can have it contribute to strokes. It definitely makes a difference in your immune system, so that cancer, which is largely a dysfunction of the immune system that hasn't picked off those cancer cells early in life and has let them grow, the immune system doesn't function and doesn't recognize and kill off abnormal cells when it's feeling stress. So you really can't look at any condition outside of, let's say, accidents and some infectious diseases and say it's not related to stress. Stress doesn't help any of them.
So how did you become aware of the link between stress and poor health?
Well, there were two things that were happening in my life kind of simultaneously. The first was that I had a whole bunch of mysterious, unexplained medical symptoms. I was chronically exhausted, and I suppose I probably fit the criteria for chronic fatigue syndrome, or pretty early chronic fatigue syndrome. So I just didn't have any energy despite doing everything right. So I was eating well and I was trying to exercise, but it wasn't working. And I had mysterious pain, and I had anxiety and panic attacks. And all of that really was affecting my function in my life, as you can imagine. You know, it's very hard when you're exhausted and anxious and in pain all the time to function normally. So that was the first thing that was going on with my life. And I realized that I needed to find a solution for myself. But this thing that really clued me into stress was playing a role was I was sitting at lunchtime one day reading medical journals. I had a stack of unread medical journals, and so I was just reading through them. And the Journal of the American Medical Association often publishes little medical retrospectives, like 100 years ago this month, X syndrome was described, and they would go through and print some of the original journal article. And that's exactly what I was reading one day. I was reading about a condition called Cushing's disease. And the Cushing's disease really is excess exposure to the hormones of stress. And the original patient described with this condition was obese, had poor wound healing, had acne. She didn't have a period and couldn't get pregnant. She was a woman in her 20s, and she had high blood pressure. And I thought, wow.
I was just going to say the same thing. Wow, that's a lot to have for one person. Yes.
Well, it's a lot to have for one person, except that what I realized was that probably 50% of the patients that I'd seen that morning in my office had most of those. You know, and I was like, wait, something's happened here in the world that in 100 years, we've gone from this combination being rare to it being something that I saw 10 people that morning.
And you had a general practice, or?
So I'm a dermatologist.
Oh, dermatologist. Okay.
Right. So I would see people who came in with acne in their adulthood. And I was like, that shouldn't be happening. But the stress hormones turn it on. People come in with poor wound healing. That's classic. You know, exposure to stress hormones has that. And in addition, I would take a full medical history and discover they were also on medications for blood pressure, and they were also struggling with their weight. And all of it, when you look at the whole thing, you realize that's exposure to our body's stress hormones chronically, all the time. And that's what it does to us humans.
So how did you have your own experience with stress and illness?
Well, so it was all of those things, like the exhaustion I had and the pain I was in and the panic attacks. And I realized that was entirely stress induced. Like there was nothing physically wrong with me. I saw my own doctors, and there was no name and no reason why it was. And when I started to really, really look at my level of stress, which I thought was normal. How do you get through medical school without having an anxiety disorder? I mean, you're almost primed, you're trained to do it. But when I started systematically taking that stress response apart and doing things very specifically that would eliminate the stress response from my life, all of my medical problems went away. Like all of them. I don't take medication anymore. I'm at an age when most people are taking 2 to 4 medications chronically. I don't take anything. I don't even take aspirin. So, and I got this sort of whole new lease on my health that I think more people need.
That's interesting, because I just had a home visit. My insurance company sends a nurse every year to check on you. And I'm 81, and he said, bring your medications out. So I have two medications, one for cholesterol and one is a chemo pill. And he said, this is all you take? I said, yeah, it's all I take. He said, if you knew how many people your age have all these bottles lined up. And I thought to myself, if I had to have all these bottles lined up, I think I'd shoot myself, but
Right.
I'm lucky that I have only two, and one is chemo, which I'm going through now, and then of course I have my cholesterol. But then again, there's so many things that I do. I mean, I work out every day. I love what I do. I try not to have stress. I mean, you can't help but have stress sometimes, but even in traffic, which there's traffic, a lot of traffic where I live, I just sit there and I say, I will get there when I get there, and people will just have to understand. But the thing that I'm curious about, Elizabeth, is that stress is not new. And stress is something we've talked about for a very long time. And yet, there are doctors who don't include that in any of their diagnosis. So why aren't more doctors aware of this? Because it's certainly not a hidden topic.
Yeah, there's this real disconnect between what we, like as a general population, what everybody knows and experiences, and then what's in textbooks. I mean, there's no textbook on the effects of stress in the body. I can take out a big fat sort of general medical textbook and try to look up the chapter on stress, and it's not there. There'd be, chapters on autoimmune diseases and cancer and things like that, but there's no chapter on stress. And we doctors are just not taught it. It's not important. We're not encouraged to talk about it with our patients, partially because we're not trained how to do it, and partially because there's not enough time in a typical visit to really go into that. So,
and they don't talk about nutrition either.
They don't talk about nutrition. There's no module on there's no module in medical school like there is on, let's say, kidney diseases, where you're going to spend a month and you're going to learn everything about kidney diseases. There's no module on stress. There's no module on nutrition. There's no module on exercise. There's no module on changing your attitude toward what it's like to be in traffic. That's the key thing that everybody should be learning in medical school, and it's completely absent. We're kind of blinded by the technology and the wonders of science that we're missing, like our body's fundamental ability to repair itself when you create the right conditions. And in order to create those conditions, you have to eliminate the stress.
Well, you have a question or that I want to ask you.
Yeah.
What is a hidden cause of stress that's very common?
So hidden causes of stress are things, what I've discovered is that there's a set of beliefs that most of us walking around with about our bodies, which goes sort of like this. My body is falling apart. I'm not, as I get older, it's normal to feel sick. I'm going to die anyway, so there's not much hope that I'll ever feel better, and other beliefs like that. Once I've broken something, or once I'm ill, I'll never be as good as I was again. And I call that whole little collection of beliefs the sickness myth, because there's actually no biological basis for most of those. When you look at the science, it's really not true. But if you look at how most people are believing, if you could ask them a series of questions, most people would say, yeah, it's normal to feel sick when I get older. Maybe not.
That's so funny, because I have to tell you something. I mean, I've been through 16 surgeries because I'm going through my fourth case of breast cancer right now. But I have not ever let that stop me. I continue to work out every day. And I have to change my workout because there are things I can't do because my body looks like a roadmap. But still, I work out to keep limber and to keep strong. And I work out with weights and I do classes and I do the treadmill and I ride the bike. And I'm 81 years old. I'm not a spring chicken. And my son says to me, Mom, you have more energy than I do. And I take these
Exactly.
midnight flights, which I don't want to take, but sometimes they're the only nonstops I can get. And I get in at 5 o'clock in the morning. And if I have to do an interview, I'm up and ready and on. And so I think it's all mindset. I'm very positive in how I think. And that's what I teach. I teach
Right.
mindset. And I
Yeah.
think that has so much to do with people and how they age.
Without a doubt, that is completely true. Yes, there's no doubt about that. And here's another thing: um, if you, for instance, it's so easy to get sucked into the mindset of the illness mindset. So if you go to the hospital to have a surgery, you'll have everybody talking to you about your odds or what can go wrong. And that sort of reinforces the potential negatives when there should be more people like you. Everybody should be like you, feeling great, ready to run, not letting your health fundamentally change who you think you are. Yeah, you may have to adjust. You may have a day when you don't feel great, but it's not going to stop you in your tracks. And that's that mindset, those deeply held subconscious beliefs that we don't recognize.
So how do you help people with that? Because I know that I work with people on positive mindset, and it really does affect a lot of things in how you even live your life every day.
Right.
But what do you do to help people through that?
Well, the very first thing I do with my clients is I give them a way to access feeling healthy again. Because one of the problems with a lot of things like meditation and mindfulness is you're not really given an idea of a goal of where you're supposed to be. And most of the people that I work with have been sick for long enough that they may have forgotten what it feels like to feel healthy. So if you can use, I have a visualization and a little process that have people do. It's not super little, but that gives people an idea of, wow, I can actually feel this way on demand. And then once you've got that and you've got that solid and you can practice that, then we look at what comes up as you're practicing that process. So if you say, well, this is just a process and it's not, doesn't apply to the rest of my health. Well, we look at that. We look at that mind, that belief, and and there's lots of different techniques for changing subconscious beliefs, but bringing them up to the surface, and realizing that your mindset isn't what you'd like it to be, that sometimes that's what you need.
But is diet and exercise enough to be healthy? Or
No,
is there no?
no.
All right.
And I know, because you can well, I mean, I'm a great case in point. I was eating very, very well, and exercising regularly, but I was taking my stress onto the treadmill with me. And I'd be on the treadmill thinking, oh my gosh, I feel horrible. I'm never going to feel better. When is this going to get better? And so, yes, wherever you go, your beliefs are with you. So if your beliefs aren't in line with the goals you want, you can do all the right things and still not get better. And this is why people have good surgeries and good treatment for cancer or heart disease and still have poor outcomes.
Wow. There are so many people, I'm sure, who are listening to this. I will tell you that I do not do a really good job at meditation. It's just very difficult for me. It's hard for me to, sit down, be quiet, not have anything around me. But I find, now this may sound really weird, but I have two kitty cats and they love to sit on top of me. And I find that when they're in my lap or right around me and I'm petting them, I'm in a meditative state. I'm not meditating, but I just love it and I'm feeling good. And the minute I sit down, I have one cat that immediately when I sit down, he's in my lap. And when I go into bed and I'm sitting up watching TV, he's in my lap. And the other one comes around and goes by my side because it's kind of like a pecking order. But that to me is my meditation. But to do real good meditation, I have not done well at that at all.
And I totally agree. I mean, I'm a yoga teacher, and I do know I've studied a whole bunch of different meditation techniques, but for some people it doesn't work. For some people it is sitting with your pet. For some people it's doing a craft, like knitting. For some people it's taking a walk or running. But some situation where I call it being intentionally bored. It's like productive boredom. So a time when your mind is just relaxed and you're doing something that um, doesn't require a whole lot of decision and input. And if sitting quietly doesn't do it for you, do something else. Pet your cat.
Yeah, I mean, I do have to say, I've just not been successful at it. But then again, you mentioned yoga, and I'm not a big fan of yoga either. I like to stretch and I like to relax, but I like the more active things. And I think it's because now I find it so difficult to be flexible because I have had so many surgeries, and my body is so uneven that it's difficult for me to do certain things. Now, it's not impossible, but I just prefer the other. But, whatever, I guess, as you say, whatever floats your boat, is what
Yeah.
you should be doing.
Right. And part of what I teach people is how to be in touch with what works for your body. There are categories of things your body needs, like it needs to have creativity. It needs to have some sort of movement in your life. It needs to have this moment of boredom. But then find what it is that works for you. Just know it's not going to look the same for you, Gayle, as it does for me, Elizabeth. And that's okay. As long as you're getting something in those categories of healthful actions, I call them, that you're fine.
Well, that's the key. So if you had one message that you wanted everybody to take away from our discussion about stress and all of that, which is not not the best thing to talk about, what would you want them to get?
I would really tell them that stress is not normal. It's not healthy. It's not something that needs to be managed in the sense of, and I can go into why that is, it really needs to be eliminated or as close to eliminated as it possibly can without becoming comatose. And it's possible to do that. It's totally possible.
I think that you're one of the few people that has ever said that stress is not normal. I think most people think it is very normal. And I'm sure you must hear 20 times a day, oh God, I'm so stressed.
Right.
Or this gives me stress. I mean, that's amazing. But I do know that you have a gift for our listeners. And that gift is you've got a PDF of the 5 hidden causes of stress that you can eliminate right away. So give us your website. Tell our listeners how they can get that, where they can go to find you, the information you have, all of that.
Well, if they want the gift, it's at thestressantidote.com, and they can get the gift there. And then my website is my name, Elizabeth Hughes, MD, and that's Elizabeth with a Z.
Okay, so now, folks, she's got 2 different places for you to go. One is her website, which is Elizabeth, just the way it sounds, Hughes, HUGHESMD.com. So that's ELIZABETH, HughesMD.com. That's her personal website. Then if you want to get the PDF on 5 hidden causes of stress that you can eliminate right away, go to the Stress Antidote, ANTIDOTE.com. So, and I would think all of you listening would want to get that because that's going to tell you how to deal with all of these things. So let's talk about, Elizabeth. We've got a few minutes left.
Right.
Are there things that we have not told our listeners that you would like to say?
Well, a second thing I'd say about beyond the stress not being normal is it takes a lot of sort of courage to step outside of the normal way that we think about stress, that we think about how life can be. It's real. I will acknowledge that it is very, very difficult when you decide I am going to get rid of stress in my life. I'm going to control and manage it, especially if you're sick at that moment. People will say, well, you're crazy. And that's, I just want to acknowledge that it's not easy necessarily to find people who are going to support you. Your friends, family members, they're going to tell you things that are right for them or what they believe, but it might not be right for you. And that's where, finding somebody who's got your best interest and your this plan, this mindset, like you do, that's key when you're making a big change to your health.
That is so true. I mean, you have to find what works for you, and you should listen to advice. You should read books. You should do your research. You should listen to doctors. But in the end, you have to make your own choices, and you have to find out what works for you. And I would think, as a dermatologist, that there are so many skin issues that are related to stress that have nothing to do with medical issues that normally people think of. But
Yes.
they come to you, well, I don't understand why this or why that. And it's really all stress related. And that is amazing. And it's wonderful that you've been able to pick up this part of it, because I just can't imagine, when people have to live with something that makes them uncomfortable or unhappy, or people will judge them by looking at them because of a certain thing. That's a very unhappy situation.
Oh, definitely, definitely. And
So,
I feel for them. Yes.
yeah, of course. So again, if you want to find out, what these stressors are for you, go to the stressantidote.com. If you want to find out more about Elizabeth, and more people are getting diagnosed, Elizabeth, online. They're not having to go into this. I mean, there's a lot, because with FaceTime and all of the things, and Zoom and all the ways that people can now connect, there's just a lot of ways that you can work with people, even if you're not in their area. So if you're interested
Absolutely.
in Elizabeth and her practice, it's Elizabeth with a Z, Elizabeth Hughes, Hughes, MD.com. I want to thank you so much for being with us today, because it's a lot of information you've given us, and I know our listeners will really have a big difference. So thank you so much for being with us, Elizabeth.
It's my pleasure. Thank you so much, Gayle.
Hi, this is Dr. Gayle, and I wanted you to know I have a whole bunch of other things to offer you. If you go to spunkyoldbroad.com, you will see an array of SOB stuff for sale and all our latest products and additions. If you're interested in getting on TV, I have a brand new course, Get on TV. And if you want to start your own business, you'll want my SOB Guide to Business Success. I know you'll love them all. I guarantee it.
This is Dr. Gayle Carson, thanking you for listening to Living Regret Free, the show that gives you skills and techniques to achieve a regret-free life. Don't live a life of stress and negativity when you could be experiencing a life of joy, happiness, and reward. Our guests all have valuable tips to make your life a better one. If you enjoyed today's show, then join us next week for more exciting and informative guests on Living Regret-Free. And I would love to hear from you as to people you'd like on the show, questions you have for me, and you can also email me at Gayle, that's Gayle Carson 13 @gmail.com, or go to my website, spunkyoldbroad.com.